Hello and good evening. My name is Snead. I'm a student at Delaware Technical Community College, and I have an interest in healthcare, and I would like to talk to you about just that, universal healthcare in the United States. The number of citizens unable to afford medical care in the United States is exorbitant. The exact statistic may vary, but a KFF research study reports that just under half of U.S. adults say it is difficult to afford healthcare costs. And 1 in 4 say they or a family member in their household have problems paying for healthcare in the past 12 months. It is truly a shame to live in one of the wealthiest countries in the world and not to be able to afford basic healthcare. To explore universal healthcare as the future of the American medical system, I would provide research regarding the existing state of healthcare in this country as well as the current models of universal healthcare in other countries. Why do I care? I bet you are wondering what my stake in this topic is. I chose this topic as I not only work in healthcare, but I have been a chronically ill patient for most of my life. It hits close to home for me, and I, just like the person in this photo, have faced the brutal force of overwhelming medical expenses and lack of care firsthand. To explore this topic, I asked the following research questions. What is universal healthcare? How does universal healthcare improve health outcomes? How does universal healthcare impact countries that implement it financially? These questions led me to begot my thesis: the United States should implement universal healthcare. Universal healthcare is a system where the government provides healthcare to all despite their ability to pay, often through taxes. Universal healthcare improves health outcomes by making care more accessible and preventing people from avoiding care due to cost. In their 2020 research review, Zeif et al. Found accessible, affordable healthcare may enable earlier intervention to prevent or limit risk associated with non-communicable chronic diseases, and improve overall public health of the U.S., and decrease economic strain associated with unhealthy low SES, which is socioeconomic status. If more people have greater access to care, it is no wonder that they have better health, especially if you can catch a disease before it progresses to deadly and expensive states. A 2018 article published by Frontiers in Pharmacology states that the life expectancy at birth and healthy life expectancy was higher in countries with universal health care, as shown by this figure. This is due to increased access to care, emphasis on preventative care, and lower costs, which often prevent people from seeking care. Now, those who are against universal health care may argue that the cost is too great to implement in the U.S. and that it will reduce the quality of care received. Universal healthcare is more economically viable than current health models. A 2023 article in the Health and Human Rights Journal points out that despite spending twice as much per capita on health as Canada or France, the pre-COVID-19 mortality rate from treatable causes was over a third higher in the United States than in Canada, and twice as high as in France. How is it that America spends double what these two countries pay in healthcare but have more people dying? Furthermore, the Economic Policy Institute claims that universal healthcare can have multiple benefits for the economy. This includes boosting wages and salaries through the money being reallocated from healthcare costs, as well as public spending increasing if people spend less money on healthcare. While all these things sound great, there are still those that oppose universal healthcare. Those against universal healthcare may argue that it is too expensive and would reduce the quality of care that people would receive. While it may appear that setting up a whole new healthcare system would be more expensive, it may actually save money in the long run. It can reduce administrative costs, it can reduce the amount that people pay out of pocket, and reduce healthcare costs through preventative care. It has also proven that countries with universal healthcare have longer healthy life expectancy. Universal healthcare has benefits that outweigh any risks. It seems that the next logical step for the U.S. is universal healthcare. So what's the big idea? You get it? Big idea. My point is this. Humans are social creatures, so wishing general well-being amongst our population should be second nature. This requires more social programs that can better our survival as a whole. This is why universal healthcare is a must. It is proven to improve health status nationwide and can be more frugal than current systems. Yes, there will be challenges implementing this system successfully at first. However, I think it is worth the effort to save lives. Thank you very much for your time and consideration. I hope I gave you some grounds to reconsider American healthcare.